Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're going to be going over how to sit with degenerative discs to help avoid aggravating your pains. Hope you enjoy. So we've covered the topic of proper seating alignment before in our video series here on the channel. We talked about keeping the center of body weight over the crease that exists between your buttock and thigh. That bone, your ischial tuberosity, should have the majority of your body weight in normal, good, upright sitting. That helps to keep the spine tall. It helps to keep the ear, shoulder, and hip vertically aligned. We talked about avoiding forward head posture because as the head comes forward, if you notice, my lower back slightly starts to slump in flexion, starts to bend forward. The discs are on the front of the spine, so as my head comes forward, as my arms come forward, that allows my discs on the front aspect of my spine to become compressed. It's creating the same problem as bending over from the waist, which compresses discs, which is one of the most dangerous motions that we mention in many of our programs for degenerative disc disease. So one of the things we can do besides keeping a nice upright posture and avoiding forward head postures is we can use a technique for degenerative disc when you're sitting for a long time that actually relieves disc pressure, because even in this seated position where I'm upright and we're sharing the load between the disc and the back of the spine where the facet joints are, we're still compressing a lot of disc fibers. We're compressing that nucleus. In degenerative discs, that nucleus has dried out. The discs have come together and come compressed, and more pressure on them, 12 to 13 times your body weight sometimes when you're sitting compared to standing, is a lot of pressure, and that's why sitting seems to aggravate degenerative disc patients. So one of the techniques that you can use is you can shift your hips slightly forward compared to your shoulders. Do you see that? Now I still have an alignment between my ear, my shoulder, and my hip. It's just that the alignment has come back. What I've done here is I've artificially taken that compression of my disc and I've changed it, because as the hips come forward and the spine goes backwards, I'm in a slight reclined position. And that's creating more vertical force at a different angle on my disc than if I were sitting upright. This many times alleviates disc pain. I can also make sure that I'm keeping my arch of my back in my typical RPI position. Now, we talked about seated positions and exercises in a pain-free and fit, as well as the Posturesize system. The crucial thing about all exercise, we want to make sure it's tailored for your body. Otherwise, we're just generically using exercise or posture to support many times dysfunction. So if you've not yet figured out what your mechanical and postural issues are, I invite you to go to either the Pain Free and Fit or Posturesize website. There's a free body analysis there you can check out. Learn what those issues are, because you want to keep that in mind as you're sitting. If you're sitting with this position, the hips forward, the shoulders back, and the head back, it is relieving disc pressure, but if I'm not keeping in mind my unique corrections, I'm further aggravating the disc more than it should be. Meaning that if I need a little more tail up with my RPI correction, I'm going to install that in that position. I'm going to tilt my tail up and pubic bone down, even from this position. If I need to be aware that I usually lean left or hip hike on the left side with my hips, I want to keep that side open by keeping my rib cage up and my hip down on that side. That creates a unique environment for that disc when it's sitting under that pressurized situation where I'm not aggravating the typical postural faults that leading to my pain. That makes a big difference in the long term of how your degenerative discs are going to feel. I also invite you to use our mobilization techniques. There's another video on that when you're sitting, so that when you are sitting for prolonged periods, you're putting some slight motion into that spine. Again, using those corrective motions based on your unique situation. That creates a much happier spine in the long run. If you like this video and would like to learn any of these techniques, please subscribe to our channel. We've got a lot of great videos on degenerative discs and lower back pain. We have a great new book that's out, a digital ebook, an exercise program you can get downloaded right away from the Pain Free and Fit website, called the Fast Track Healing Exercise Program for Degenerative Discs. It's specific for degenerative disc problems. It has this tip in it and 100 more exercises, as well as tips to help prevent and help heal your degenerative disc condition. Thanks for watching. I hope this helps you with your degenerative disc disease.